On this Friday night, the Prime Minister's warning to contain Canada's deadly surge.
We need to step up now.
Provinces toughen up and expand restrictions as infection rates explode.
We have to get the community spread under control.
A widow's pain after the verdict in New Brunswick's mass shooting.
We don't ever get the opportunity to pack up our grief and put it away.
Why did a jury find the accused killer not criminally responsible? Not all are on board. Why many in an Ontario town are turning their backs on a concept to transport goods on trains over tracks.
Global National with Donna Friesen. Reporting tonight, Robin Gill.
Good evening and thank you for joining us. We begin with a difficult but urgent message to Canadians about the spread of COVID-19. With case numbers surging, Prime Minister Justin Trudeau is warning if we don't do more now to limit our contacts with other people, Canada is on a path to disaster.
The only way we can reverse the tide is if we immediately reduce the number of people each of us come into contact with. If you live in a region that is experiencing a surge in cases, stay home if you can and avoid all non-essential travel. We need to step up now, all of us.
Here's what could happen if we don't make changes. According to new federal modeling, if we keep doing what we're doing, Canada could hit 20,000 cases a day by the end of the year. If we increase our social interactions, that number could skyrocket to 60,000 cases a day. If we reduce our contacts to essential activities only, Canada can get the second wave under control. Global's David Akin has more on the Prime Minister's message and what's at stake as Canada heads into winter.
I don't want to be here this morning. You don't want me to be here this morning. But here we are again. The cases across the country are spiking massively.
The Prime Minister back in front of his home to make the point that Canadians should stay home when they can and take other measures to crush the COVID-19 curve.
I am today using my voice and my position as Prime Minister to talk to all Canadians, to tell them that we're in a serious situation where they need to listen to their premiers, they need to listen to their public health experts on what they can do in their jurisdictions to do more.
The reason? A grim forecast on the eve of winter. Continuing on the current course means 20,000 new cases a day by year end versus the current rate of 5,000 new cases a day.
But absolutely do not go above what we have now. Otherwise, we are in really in trouble.
Already, critical care beds are at or near capacity in some parts of the country. And the disease is now picking up in Indigenous communities and in Nunavut, where health resources are scarce and options to isolate are few. And yet, Trudeau said the tough decisions about more lockdowns and more restrictions must be left to the provinces, not Ottawa.
Provinces have lots of tools at their disposal, and I'm not looking to bring in a federal hammer.
Still, critics say that has led to confused and mixed messaging. Masks are mandatory in one region, but not another. Gatherings allowed here, but not there.
It's unfair and it's frustrating. Yep, there's no question about it. But we're not in a fair situation.
And it will be like this for weeks.
A normal Christmas is, quite frankly, right out of the question.
The goal now? Keep as many Canadians as safe and healthy as possible until the first vaccines arrive. David Akin, Global News, Ottawa.
Here's a look at the situation in Canada today in terms of new infections. There were 17 new cases reported in the Atlantic bubble and 10 new cases in Nunavut. BC has 516 new cases. Alberta broke another record with 1,155 cases. Across the prairies, infections remain worryingly high. There were more than 1,200 new cases in Quebec and 1,400 in Ontario. Tough new restrictions are coming into force in parts of Ontario. Toronto and Peel region, two of the hardest hit, are headed back into lockdown.
My friends, I've been clear on this. The situation is extremely serious, and further action is required to avoid the worst-case scenario.
Schools will remain open, but starting Monday, most non-essential businesses will close. There will be no indoor dining, and people cannot socialize indoors with anyone outside their household. Mike Drolet has more on the new restrictions and the reaction.
For the past week, Premier Doug Ford has warned Ontarians they were staring down the barrel of another lockdown. Today, on his birthday, he pulled the trigger.
Effective Monday, November 23rd at 12:01 a.m., Toronto and Peel will be moved into lockdown.
The rules are strict. No indoor private gatherings and religious ceremonies will have limits of 10 people. Non-essential retail and restaurants will be open for pickup and delivery only. But gyms, casinos, and theaters will all be closed, which is devastating news for the business community.
The business is already in an incredibly weakened position. How many more days those businesses can stay alive is anyone's guess. But we're predicting an absolute bloodbath in the days ahead, with 1 in 7 small firms permanently closing their doors forever. I'm deeply worried, and any additional business restriction is going to hurt hard.
Manufacturing and construction will stay open, as will schools, but Ford says there was no longer any room for half measures. Ford's announcement came just a few hours after the Toronto Raptors delivered their own bad news. With the federal government blocking all attempts to play in Canada, the decision was made for the team to relocate to Tampa for the upcoming season. There was just no way of ignoring the surging wave of COVID-19 cases.
I'm really hoping in this crisis at this point that people are actually listening.
Over the past 2 weeks, Ontario's 7-day average for new cases has risen 29%. But in that same period of time, the number of hospitalizations has increased 36%. And most concerning, COVID cases in ICUs have risen 65%, which is nearing the threshold for what the healthcare system can handle without emergency measures.
Frankly, it didn't need to come to this. If Doug Ford had not dithered, if he had not introduced a series of half measures throughout the fall and had been decisive earlier in this pandemic, we would not be, I don't think, in the shape that we're in right now.
If the numbers go down, the hope is the holidays won't be a total loss, but for now, they're looking awfully quiet. Mike Drolet, Global News, Toronto.
A man in his 20s has become the youngest person in Manitoba to die of COVID-19. He was among the 9 people reported dead today. In total now, in Manitoba, more than 200 people have died of the virus.
All these announcements are much more than numbers. These are people. This is a young man. There are certainly some underlying conditions, but this is, tragic to see all of these listings every single day.
Dr. Rusin also warned about an escalating crisis southeast of Winnipeg. In the city of Steinbach, 40% of all people getting tested are receiving positive results. Rusin is calling for immediate action to help bring case numbers down. In this second wave, the number of outbreaks in long-term care homes across the country continues to rise. Today, 102 homes in Ontario are in outbreak mode, with 8 new deaths reported. Families are fed up, calling for action. Abigail Bimman checks in on the state of things in long-term care across the country.
Vascular dementia and Alzheimer's, but she's still with it enough to know that I'm not there with her.
Roseanne Riley's mother is 104. 23 people have died at her Ottawa long-term care home. Riley says her mom was left with a COVID-positive roommate for 48 hours. Saturday, she tested positive.
And if protocols are in place and we're doing what we should be doing, I mean, how does this happen?
Riley was one of several people who shared concerns about the Ontario system Friday.
Shut these houses of horror down.
She died alone. My priority now is the well-being of my father within the long-term care system, the grieving spouse.
We have to lock this down. No excuses anymore.
This week, Ontario announced increased long-term care testing and 3,000 new beds.
We are investing more than $500 million in additional supports for long-term care during the second wave.
we're seeing these homes in Ontario, which has the most outbreaks, and other places like Manitoba that never actually had staffing contingencies in place, really see the brunt of a lack of preparation.
Experts say nationwide the second wave is just as troubling. Staffing shortages are still an issue, plus there's an increase in community transmission.
In the second wave, rather than the military now, we're starting to see the Red Cross.
Half the residents of this Winnipeg care home have COVID-19, so short-staffed they're asking family members to come monitor loved ones.
Quite a reduction in staffing because of COVID transmission. The ERS team, the paramedics are there right now.
While Saskatchewan announced a new visitor ban at care homes except on compassionate grounds, and Nova Scotia is now stopping residents from leaving for off-site visits. But the province's top doctor says visits at the home must continue.
You need to look after the care of the residents, not just their physical health, but their mental health as well. It's not okay to put barriers to that happening.
As for this 104-year-old, Extendicare tells Global News they can't speak to her case due to privacy, but that separating positive residents is a priority. Riley wants more answers.
I know she's old, but she's my mother, and she means something to me.
Abigail Bimman, Global News, Ottawa.
A vaccine is key to fighting COVID-19 and getting our lives back to normal. Today, drugmaker Pfizer applied for emergency vaccine approval in the U.S. The filing starts the process that could bring a limited number of shots as early as next month. The U.S. Food and Drug Administration and its independent advisors will now debate if the shots are ready. Earlier this week, Pfizer announced its vaccine appears to be 95% effective. Competitor Moderna also expects to seek emergency authorization of its vaccine. In the history of coronaviruses, why does COVID-19 cause such swift and widespread illness? New research suggests patients diagnosed with COVID-19 are especially infectious in the first few days of the illness. As Eric Sorsensen tells us, the report reinforces the need to isolate as soon as symptoms appear.
With many viruses, people often get the first cough or sniffles and just carry on, going to work or meeting with others. But with COVID-19, health officials emphasize the need to isolate quickly. And a new study explains why. Research in the Lancet Microbe compared coronaviruses from previous outbreaks and finds that symptomatic patients diagnosed with COVID-19 had the highest levels of live virus in the first few days.
This virus, more so than a couple other viruses, seems in some patients to shed a lot of virus. So when you're sick, you're actually releasing a lot of virus, and that's always problematic for infection of other people.
The COVID-19 virus was most infectious very early, in the first 5 days after the onset of symptoms. With previous outbreaks years ago with SARS and MERS, the viral load peaked later, with MERS 7 to 10 days after the onset of symptoms, and with SARS 10 to 14 days later. So with those viruses, the symptoms would tip you off early and you could isolate before the infection was at its worst. But with COVID-19, the infectiousness is at its worst as soon as the symptoms appear, which is why COVID-19 is so hard to contain.
Other studies have shown some COVID carriers are infectious before they show symptoms, making the spread even harder to contain.
And that's why we ask people when they've potentially had contact to self-isolate regardless of whether they're currently testing positive or not, because we're still missing that critical piece of information before you develop symptoms.
While the virus spreads quickly, the Lancet research also found that no live virus remained in symptomatic patients after 9 days, so the infectiousness to others does drop off dramatically. One other new study says COVID carriers develop immunity that is now shown to last at least 6 months.
This is potentially significant news. It extends the period for which we know there is likely protection.
Evidence of a strong immune response gives researchers optimism that vaccines now in development will also have lasting immunity. Eric Sorsensen, Global News, Toronto.
The verdict many victims' families didn't want. Coming up, a jury finds the Fredericton shooter not criminally responsible. Two years ago, Fredericton was rocked by a mass shooting. Matthew Raymond shot and killed 4 people, including 2 police officers. Today, a jury found him not criminally responsible because of a mental disorder. For more on the verdict and how the community is reacting, let's go to Global's Silas Brown. Silas?
It took the 11-member jury 25 hours over the course of 4 days to reach a verdict. After the verdict was read, Raymond could be seen wiping tears from his eyes, and some members of the victims' families ran from the room and could be heard sobbing in the hallway. Jackie McLean is the widow of Rob Costello, one of the police officers killed.
I was hopeful that he would be found responsible for it, only because I don't think he's acknowledged responsibility or his responsibility for this.
Here's how the case has unfolded. Raymond faced 4 counts of first-degree murder dating back to the morning of August 10, 2018, when he opened fire from inside his Fredericton apartment. The shooting began just after 7 in the morning and lasted less than half an hour. Donald Robichaud and Bobby Lee Wright were shot as they packed up their car for a camping trip. Fredericton police constables Sarah Burns and Rob Costello were the first officers on scene, responding to the active shooter call, and were shot before they could draw their weapons. That Raymond shot and killed the 4 victims was never in dispute. His lawyers admitted as much, but they argued that Raymond should be found not criminally responsible for his actions due to a mental disorder, and 3 separate forensic psychiatrists have diagnosed Raymond with either schizophrenia or delusional disorder during the trial. But the central issue the jury was tasked with deciding is if that mental disorder impaired Raymond's ability to understand the nature and quality of his actions, or that they were wrong. Raymond testified that he believed the end times had begun and that he was under attack by demons, having barricaded himself inside his apartment with loaded weapons for days. The defense has argued that this is supported by the mountain of electronic data. The Crown has acknowledged that Raymond was experiencing delusions the day of the shooting, but says that they were less intense than he claims and that he targeted the 4 victims knowingly. Raymond will now be sent to New Brunswick Psychiatric Hospital in Campbellton, where he will await a disposition hearing in December that will decide if he is treated at the federal or provincial facility. Robin?
Silas Brown in Fredericton, New Brunswick tonight. Still ahead, Donald Trump's new strategy to ignore American democracy. The cases of COVID-19 in the United States are soaring to new levels. More than 80,000 people have been hospitalized. That's the most since the pandemic began. The U.S. has also set a new daily COVID-19 record. More than 187,000 people tested positive yesterday. The U.S. president is showing unprecedented disregard for democracy. Today, Donald Trump met with state lawmakers from Michigan in a bid to convince them to ignore the will of voters. Let's bring in our Washington Bureau Chief Jackson Prosko. Jackson, what is Trump's strategy here?
Well, Robin, simply put, Trump wants Republican-controlled state legislatures in key swing states to ignore the fact that voters picked Joe Biden and instead appoint a new slate of electors to the Electoral College. Remember, it's those electors who ultimately go on to pick the president. Those 2 Michigan lawmakers you mentioned flew to Washington today to meet with President Trump. It's not clear what they discussed, but it is clear that this is part of a maximum pressure campaign to get several states to ignore the wishes of voters. Shortly before that meeting, we should point out that Trump again insisted he won the election. Robin, it's very clear he did not.
But he continues to argue that there was some kind of voter fraud. Is there proof?
No, there is no proof at this point, and not only has he not offered proof, of the 30 lawsuits filed by the Trump campaign, only 1 has been successful. Most of those complaints have fallen apart or simply been withdrawn due to a sheer lack of evidence. Tonight, the state of Georgia, though, is moving ahead with certifying its results in favor of Joe Biden. They found no fraud or irregularities that would stop that from happening. Meanwhile, Biden's team seems to be losing patience with the stalled transition. The president-elect today met with Democratic congressional leaders like Nancy Pelosi. They together have not ruled out going to the courts to compel Trump to cooperate with the transition process, a courtesy, we should point out, that was extended to Trump by outgoing President Barack Obama 4 years ago.
Jackson Prosko in Washington. Thanks, Jackson. Up next, could a train project in Ontario derail the health of people living nearby? One effective way to reduce greenhouse gas emissions is transporting goods across the country by train instead of truck. CN has been pushing to do that for 20 years. It wants to build a terminal where shipping containers can be transferred onto trains. But some residents in Milton, Ontario, the proposed site, aren't on board. Jeff Semple explains.
Priscilla Burton's 5-year-old son suffers from asthma, and their hometown of Milton, an hour's drive west of Toronto, offers a breath of fresh air.
We had more access to like countryside and farms and conservation areas.
But Burton's family, like many others here, is worried about a new neighbor poised to move in down the street. CN, the Canadian National Railway, purchased this stretch of land with plans to build an intermodal terminal. The facilities provide an environmental benefit by taking long-haul trucks off the road and transferring goods onto trains.
It's a great idea. I fully support it. There's just one problem with Milton. It's the wrong place.
This transportation analyst says most terminals, like this one in nearby Brampton, are built in industrial areas. But in Milton, it's a much different story.
CN's proposed site here in Milton sits just across the street from a sprawling residential area within a kilometer of thousands of residents, a hospital, and a dozen schools.
The site would see 800 transport trucks rolling in and out of the area every day. An independent government review panel found most of the adverse environmental effects from the terminal are likely to occur anyway because the lands have been designated for future development. But the panel concluded the terminal is likely to cause significant adverse environmental effects on air quality and on human health as it relates to air quality.
I'm not just talking about one or two, and I'm talking about the masses of the people just don't want it.
But in this case, the community doesn't get to decide. The rules governing rail companies are as old as Canada. Written back in 1867, the Constitution ensured railways were the domain of the federal government. As a result, CN's fate falls to the feds.
This could be Saskatoon, this could be Vancouver, it could be Halifax, it can be anywhere.
CN declined our request for an interview, but noted the review panel also found CN's criteria for site selection were reasonable, and the proposed site could support an intermodal terminal.
They're kind of putting their company's interests ahead of our health.
The government's decision is expected within a month. Jeff Semple, Global News, Milton, Ontario.
And tomorrow, an environmental health expert who studies cancer risks weighs in with his take on the risk posed by pollution from the proposed terminal. That's on our program, The New Reality, Saturday at 7 p.m. with Donna Friesen, right here on Global. And that is Global National for this Friday. I'm Robin Gill. Tonight, your Canada is Cashabog Lake in Ontario. Thank you for watching, and I'll see you here this weekend. Have a great night.